Organization Values and Mission in Nursing. Organizational Change and Change Theory by Martia Perry. Organizational culture relates to the practices and behaviors of an organization. It is put into practice by an institution in the performance of duties to achieve shared values, goals, and vision. Culture is the collective consciousness and practices of a group. Organizational culture makes a group distinct from another group. Most often, this is displayed by the uniform of said groups, their specific profession, language use, and norms. Most often, we see this in hospitals where the nurses wear the same color uniforms as each other and different from other specialties. Magnet status is an organizational credential that is earned by achieving performance-based standards. Magnet status is an organized framework that can be used to assess or improve an organization's culture and impact its nursing services and ultimately drive patient outcomes in a positive direction. Magnet status was developed by the ANCC with the goal of identifying excellence in the delivery of nursing services. Positive associations with teaching affiliation, hospital size, nonprofit ownership, admission rates, registered nurse staffing rates, and cost effectiveness are just some of the positives that magnet adoption has entailed. One of the key organizational factors associated with the likelihood of magnet adoption were larger hospitals, higher RN staffing, and lower LPN staffing rate. It applies to the consumer that they will receive top-notch care. Guiding nursing practice. The magnet concept, as an innovative strategic choice, assists healthcare leaders in better managing their resources to improve cost effectiveness of hospital care. So for better patient outcomes, the magnet program intense focus on nurses indicates that as many as 20,000 hospital deaths per year could be linked to inadequate nurse staffing levels. Better patient outcomes in magnet hospitals have been attributed to better nursing quality and a better work environment. Magnet hospitals have been known to comply with the national standards for heart attack, heart failure, and pneumonia acute care. Change may be planned or unplanned. In healthcare, a change agent is a person who brings the changes that impact nursing services. Change agents must use the appropriate change theory in order to facilitate change. Kurt Lewin's theory involves 3 stages: the unfreezing stage, the moving stage, and the refreezing stage. This theory depends on the presence of driving and resisting forces. For this theory to be successful, the driving force must dominate the resistant force. Rogers' change theory has 5 stages: awareness, interest, evaluation, implementation, and adoption. This theory is applied to long-term change projects. It is most successful when people who ignored the change earlier adopt it later because of what the ones who already adopted it are saying. Spradley's change theory is an 8-step process. You recognize the symptom, diagnose the problem, analyze alternative solutions, select the change, plan the change, implement the change, and evaluate and stabilize that change. This theory allows constant evaluation of the change process to ensure its success. Some barriers to change are that some people feel that there's no need for change, or no time for change, or they just don't understand the change, or they don't trust the people who are changing. The employee response sometimes presents a barrier. especially when they lack readiness to change. Leadership can shape the culture of an organization, and a culture of effectiveness can help increase employees' readiness to change. Here's a quiz. During your job interview, the interviewer informs you of the many changes that the facility is undergoing. You recognize that the purpose for a change is A. To improve efficiency, B. Random actions by the facility, C. Annual mandatory changes, D. Because the nurse manager said so. The answer is A. Another quiz question. The two biggest problems in healthcare today are related mostly to patient data and flow of information, B. Patient safety and soaring healthcare costs, C. Physician conflict and consumer groups, D. Employee conflict and clinical expertise. The answer is B. Patient safety and soaring healthcare costs. References.